Welcome to the Pharmacists Are In, a podcast made for pharmacists by pharmacists. Pull up a seat and let's get started.
Welcome back, everybody, to another episode of the Pharmacists Are In podcast. I'm your co-host, Ajit Johal, and I'm joined by Ontario pharmacist John Papastergiou. John, how are things?
It feels like it's been a while, since we've been on the air together. Pretty good. I guess you have some news, big life-changing moment for you over the last few weeks.
Yeah, totally. So we just had twin boys. So it's been hectic, and I very much appreciate this reprieve, hiding in my basement and recording another episode with you, John. So it's definitely been very busy, but it's definitely been an experience for sure.
Big life-changing moment. Family's getting bigger. I hope you took some of my advice. I remember last time we were waiting to go on air, I was giving you some advice, but you can never really be totally prepared for it, eh?
No, it was great advice. I took all of your advice, and it's still hectic. What can I say?
For sure. Little bit of a different segment for us here today. We're actually lucky enough to be joined by a guest.
Yeah, so it's really great to have pharmacist Susie Jin on our podcast, and Susie was kind enough to join us on the Pharmacists Are In, and she brings such an incredible wealth of experience, clinical experience, and personality. She's definitely been on the presentation circuit with us, John, at Pharmacy U and other pharmacy conferences, and she was kind enough to share her bio. And I always say, when you're moderating events, John, how annoying is it if you give someone your bio and they just read it? They literally go line by line. It's agonizing, and you're just like, oh my goodness. So I am not going to do that. It's a great bio. Me reading it's not going to do it justice. There's three things that really stuck out to me and really make me excited to have her on the show today. The first is not only being a certified diabetes educator, but being really plugged into Diabetes Canada. So the Diabetes Canada Clinical Practice Guidelines and the Dissemination and Implementation Committee. So I'm sure we're going to have some offline chats on how we can integrate more vaccine recommendations in diabetes care for sure. Second, is a member of the Ontario Immunization Advisory Committee, and obviously as someone who's big in the vaccine space, it's great to see a fellow vaccine expert. And then, of course, Charles Best Award, which is a big award. So Banting and Best, from what I recall, they invented insulin in Toronto. So that's a really prestigious award dedicated to significant impact in Canada towards improving quality of life of individuals living with diabetes. And the third, and probably the most important, is Susie's very committed to lifestyle, a healthy lifestyle, which includes getting all her vaccines and running marathons, which is very respectable, John. I don't know the last time you ran a marathon, but I'm currently at 0. But she's run 5 out of the 6 world major marathons, and even Olympic distance triathlon, which I can't imagine how difficult that is. So thank you so much, Susie, for joining us on the podcast, and we really look forward to having you today on the episode.
Thank you guys for having me. It's you're saying you had such a lovely introduction. Thank you for not reading it. Thank you for making me sound better than I really am. But it's such an honor to be here. I mean, when you guys first invited me, I thought, oh my gosh, Ajit and John, you are the experts. And I'm indebted to you for sharing your knowledge through the Pharmacists Are In podcast, but through all the other things that you do, that we do together. It's an honor to share the stage with people that are equally passionate about pushing forward the profession of pharmacy.
Yeah, Susie, thanks for that. And one of the things I wanted to ask you, and I know, anyone that's sat on any guideline committees or if it's done any knowledge translation work, I find this is a huge opportunity for community pharmacists. I find we struggle with this as a profession. We're most pharmacists are on the front lines. They're busy. They're kind of jacks of all trades. And to be in that role where you're trying to translate new guidelines in whatever diabetes, specific to what you do. And I feel like it's something we haven't really done a great job at. And I don't know why that is. It seems like there's so many barriers that anyone doing this type of work, it's very challenging. Have you found that as well?
Yes. Yeah. And you know what? I think all the different committees I sit on, so I do sit on the steering committee for Diabetes Canada Clinical Practice Guidelines, which is a huge honor, like being on the national committee that's actually determining the clinical practice standards, across Canada. So that's a huge honor. And then I also do similar for Wounds Canada, in that I'm on the board of directors for Wounds Canada. And in all of these committees that I sit on, and the Ontario Immunization Advisory Committee, it's incredible to see all the gaps in care, and how many times the role of the pharmacist could be leveraged to fill that gap in care. But the problem is that there's so many times when they want our help, they need our help, and we can help. But so many times our hands are tied, and many times there's no remuneration for it. So it's very hard for me to be on the committee saying, this is what pharmacists can do, and this is what we can do. And we can do it. We absolutely can. But you know what? There has to be the compensation that comes with it. So, and that's not the committees that I end up sitting on, because those are, the government committees. And, what comes first, the chicken or the egg? But at least we're still pushing forward and getting the role of the pharmacist recognized, what we can do. And so when I do a lot of the presentations and, Pharmacy that you'd mentioned, a lot of it is, yes, we have to show what we can do, and we have to come to the table ready to do the work, and hopefully the remuneration is just going to follow.
Definitely. And I think one of the big things that we can actually, as Canadian pharmacists, and John, we both can actually speak to this globally, what we see in some of our work we do there, is we've really established ourselves as immunizers. So from there, I think there's a lot of opportunity to continue to build on that in terms of administering more antigens, and especially as we get into fall respiratory season, really doing our part as pharmacists to make sure that our most highest risk patients are vaccinated and up to date on their immunizations. And that, of course, includes patients with chronic medical conditions like diabetes. And it's really a perfect storm for the pharmacist to have a huge role, because most Canadian adults get their flu shot, their updated COVID shot at the pharmacy, and patients also on chronic medications are getting it filled at the pharmacy. So really there's an opportunity. But what we're seeing is that, especially with COVID-19 vaccinations, a lot of Canadians, especially those who are at higher risk, are not up to date. So we'd love to talk about today what this looks like, obviously why patients with diabetes should be vaccinated, up to date on all of the recommended immunizations, including COVID-19, but also some implementation strategies for pharmacists in clinical practice, which I think all of us have some very interesting perspectives. So I guess I'll kind of turn it over to our guest, Susie. In your experience as a diabetes educator, where does vaccines come into the conversation, and what has your experience been specifically on COVID vaccination?
Excellent question. I think, where we've been has fallen short of where we should be. And so I hope we can talk about where we should be and where we should be going. And I think the thing with COVID is that it has been an evolution, and that we've been really had to push it out fast, and we had to be reacting a lot. But I feel like, and you guys should, John, tell me if you think I'm right here, that I think this is the year when we can change the approach. And it really should be, you're here for your flu shot, here's your COVID shot at the same time. And you can also be, I think in past, I've always was also assessing the pneumococcal, because that was available, and the Shingrix. And I did a lot of, I don't know if you want to call it upselling, but seriously, like people would come in for their flu shots. And prior to us having COVID, I was absolutely assessing them and getting them the shingle shot and faxing over to the doctor. We had a form letter that we faxed over. And so in that way, we did a lot of billing to the third-party drug plans, and were able to build our vaccination practice within our pharmacy, but certainly help improve clinical outcomes. And now it's just taking it a step further, except we don't have to worry about faxing it to the physician and requesting requesting their authorization on it. We're just, you know what, you're here. Let's get you all up to date.
Yeah, and I think, Susie, it's funny you say that, because I think in our, in my company here, like kind of with our brand, we really tracked co-administration last year. It was one of the metrics we were looking at to see, this idea of optimizing the immunization visit. We really wanted to kind of see if we could get those numbers as high as possible. And I think we set a target for ourselves around 30%. And we thought that might be ambitious. We actually got pretty high. We were sitting around 60 by the end of kind of the respiratory season. And I think one of the things that worked for us, we really tried to leverage the technology, right? If you're coming in for your flu shot, you're doing your consent. One of the questions would ask, hey, have you had COVID? And if you had some of these other vaccines, the numbers I'm talking about are really specific to COVID and flu. I mean, we haven't had a ton of success with some of the other vaccines, but there's definitely an opportunity there. And I think it's something our profession can probably do better than most others, just because we've got all these patients coming in, and they're going to come in large numbers over the next little while.
That's a great point, John. I wonder if we should change our flu shot consent form to have a little tick box. I would like to get my COVID shot at the same time, or something like that. And that it just becomes standard. It's almost like that presumptive ask. It's right there.
Yeah, we have that there. We've already built it in. I don't know, Ajit, if you've got the same thing, but.
Well, I think the thing is where I'm seeing a bit of disconnect is, even if individuals are flagged in a discussion to say, are you up to date on your COVID vaccine? And that's the terminology. I think, Susie, you really hit the nail on the head is can we settle into this narrative now? Because, when the pandemic started, vaccines approval, primary series, and then boosters, and then now it's all about up to date. And now it's about really protecting high-risk population groups. And what I'm seeing in a lot of my high-risk groups is they're not opposed to getting a vaccine. They just think they've already had a lot. They said, I'm on my 8th dose. There's this really funny internet meme where, someone's got a punch card and they've got 8 and they get a free pizza because they've collected 8 different COVID vaccines. And that's kind of how it started, right? The vaccines that were first on the scene were the mRNA vaccines. Over 100 million doses given in Canada alone. So I cannot think of a better post-marketing study sample than 100 million doses. So we know that technology is very effective. It's very safe. And most Canadians have gotten at least 1 dose of an mRNA vaccine, if not more. Where the challenge is coming in is COVID came on really hot, really strong. Lockdowns, vaccines, lineups, gyms, Metro Toronto Convention Center, all of that stuff. Pharmacists, John, you had even had stories of generals coming in. So it had all these bells and whistles. And then all of a sudden, poof, we're back to pre-pandemic, right? The restrictions are not as robust, but the virus is still here. It's still infecting. It's still putting people into hospitals. So the big understanding as pharmacists we need to communicate with our patients is, are you up to date? That's the buzzword. I think that's what I really want to recommend to our national audience, is not how many COVID doses have you had, not have you had your COVID vaccine, is Mr. So-and-so, Mrs. So-and-so, I'm your pharmacist. Are you up to date on your COVID-19 vaccine?
Gee, I don't mean to disagree, but I'm just going to clarify on that, because I think now that we know that they've pulled all the doses, so nobody's up to date. Come today, literally nobody's up to date, because everybody, as soon as that KP2 variant comes out, everybody is due for that. So I feel like it's not a matter of asking you, are you up to date? It's, are you going to get this shot because you're here for your flu shot? So let's just get both. And that's just a start. I mean, that's just, the easy wins is just, you're already here for your flu shot. I'm just going to get you your other one, because now we're going to get you up to date. Because, as opposed to asking if we know you're not up to date. Let's get you up to date. But then the next question is the next step would be, like you said, searching out those people who are at higher risk for hospitalizations and death due to COVID, and making sure we get them vaccinated and their communities of care vaccinated.
Yeah, I think the point here is we've kind of created this mentality with patients where they're actually counting their COVID vaccines. Well, they don't do that for flu. You can ask anyone; no one knows how many flu shots they've had, or it's the way we started, and they really are aware of how much vaccines they've had. And I think it just correct in the sense we got to get away from that mentality that it's something that's going to, for all intents and purposes, could very much be something you get every year. And they got to get away from counting. I mean, it's not. And I think it's irrelevant by this by this time.
I think it's definitely irrelevant because it also depends on technically which variants of the COVID shot that they got. So, if you got 4 shots, but they were all the original version and none of the XBB 1.5 version, then, it's not the same.
So, Susie, it's a good segue then. What are we expecting, for the pharmacist that's listening now? What's coming? We said we pulled pretty much all the vaccine that we had. So what are we waiting for right now?
So it's the new variant, the KP2, which is interesting. Just, I guess we could share with the audience, but sometimes I try to stay away from the nitty gritty details. But what is interesting is that Australia and Europe went with the JB1 vaccine, and we in North America are going with the KP2. So we're just going with a different variant than what they went out with. But I think that's okay because that's what they do with the flu shots.
Yeah, absolutely.
Yeah, and I guess, to get technical, we're still on the Omicron lineage. And I think what pharmacists need to understand when counseling their patients is, at the end of the day, as these variants get further and further down the variant tree, and there's actually a really good diagram of how divergent these lineages get from XBB and all the way to JN and to KP in the CDC, and we'll share that in the show notes. And I think what patients need to understand is we need to present the antigen closer to that. So there is cross protection that works, but the cross protection is better as we get closer to what's out there. And I think one common sort of cynical objection, which I think is fully, I think that I fully empathize for patients to be frustrated, is like, we'll never catch the variant. And despite the marvels of mRNA technology and how quickly that can be used to make a very safe and deploy a very safe and effective vaccine, is the virus will continue to, mutate, and we will always be catching up, but we will get as close as possible. And I think 2 things that make a big difference for patients is what was the last vaccine they got, is which variant was it against, because obviously if it's diverged, and when. Time is a huge predictor of how well you're going to do if you encounter this virus in the community. Obviously, if you're more up to date, your immune system can fire off neutralizing antibodies. The T cell response is better. So it's that time. And we see, especially in our high risk patients, as little as 3 to 6 months after a vaccine or even a COVID infection, which doesn't confer very good immunity, we're seeing reinfection. And reinfection is bad because, some may have gotten COVID once, recovered. The second, third infection could be the one that lands them in hospital, or potentially even worse, leads them with post-COVID condition with complications. So I think we need to look at matching variants, but also the time and when they got their last vaccine.
So Susie, knowing that, what approach do you take with your patients? There is vaccine fatigue out there. It's, I hear it every day in my pharmacy. You know what? I've had too many doses already. I think I'm good. How do you convince them to kind of stay on top of this? And I find the seniors are a little bit, easier. They're coming in, they're worried about, getting really ill. But for me, it's more the younger patient cohort. What's your approach?
I keep it simple. I listen to how Ajit talks. He's so smart. And I'm like, oh my gosh, you are so smart. I literally just say to people, you know what? I'm going to get you the shot. I took it. I give it to my kids. I recommend it. And Ajit, congratulations on twins. Oh my gosh, how exciting. I can't believe you have time for this and all the other things I'm going to get you to do for volunteer. But wow. Okay, maybe I can babysit while I get you working on all the Diabetes Canada work.
I will take any babysitting support.
You know what? When you have these kids, you can then, you actually, it means a lot when you say to people, I'm giving you the shot, or I recommend the shot. I had the shot, and I made sure my kids got it before they went off to university or wherever they're going.
Definitely, and I think that often is the real nuts and bolts of a trusted healthcare professional relationship that providers like physicians, pharmacists, nurses have with their patients is make it personal. Like, is it safe? Is it effective? And is it good enough for me and you? And I think that hits the nail on the head for sure.
But it's funny, you guys bring up the fact that have you had it? I mean, my patients will ask that. I've got a lot of senior ethnic patients. The first thing they ask is, have you gotten it, right? And the reality is, if you speak to pharmacists, many of them aren't up to date. Notwithstanding, we don't have the newer vaccine, but many of our colleagues have dropped off on how many doses they've gotten. And I think it's a tough sell if you haven't been vaccinated to recommend it to your patients, right? And I think I just came back from FIP, and it's funny how the world, I mean, we spent a lot of time at trying to assess what we're doing here in Canada. The rest of the world is really looking at Canadians, Americans, maybe the UK and the Australians for what to do with their vaccination programs, right? We really have set the standard, and it's actually awesome to see when you get to these kind of global conferences. And I was giving a talk on overcoming barriers, and the audience there was just stunned at how far we've come as Canadians. But one of the other speakers, Dr. Kenneth Alexander from the US, we're on a panel about choice. Question he asked the audience is, how many of you are vaccinated, right? And that really is key. If you're not vaccinated yourself, it's hard to sell it to some of your patients.
But then you wonder, why are people choosing not to become vaccinated? And it's funny because if you say pharmacists, I mean, they're actually at work. It's not like they have to make an appointment and go someplace, To me, it's like, if you don't get vaccinated, I don't know. To me, it's like playing Russian roulette. Like, you could get COVID, you could get post-COVID, you could get long-term post-COVID symptoms. Why would you do that to yourself? Why would you put yourself at that risk?
I often say, as healthcare professionals, we make the worst patients. Could be part of it, but I think honestly, there is this sort of that level of complacency. Vaccine hesitancy has 3 domains: complacency, confidence, and convenience. And even if it's convenient and we're confident, safe, and effective, all of us are victims of complacency. And it's interesting because even the updated fall NACI recommendations lists essential workers. And John, during the lockdown, who was on the front lines, right? Couldn't work. You can't run a pharmacy without a pharmacist. So that's as essential as it gets. So we are on that list of strongly recommended cohorts to get up to date on the COVID-19 vaccine.
John, you know how you said most pharmacists are not up to date on our COVID shots? Do you think that would be the same percentage of people who aren't up to date on their flu shots?
Yeah, I mean, it's more anecdotal. I don't actually have any data around it. I know when you look at the healthcare professions, I think nurses are actually worse than pharmacists for their kind of uptake of vaccines. But yeah, like, just anecdotally speaking to kind of pharmacist audiences, it's one of the things that comes up even amongst the pharmacists, that they feel, I've had a few doses, I'm young, otherwise healthy, I don't need it. But the reality is we're in a super high risk setting. And beyond that, people value our opinion. They trust us more than anyone else. And if I tell my senior patients I'm not vaccinated, many of them won't do it. They'll say, well, there's got to be a reason John's not vaccinated, right? So, yeah, it's just something I think it's important because it comes up, and it came up in our discussion today. One of the first things you'll get asked is, what are you doing for yourself and for your family? And if you can't say you're all vaccinated, I think that's a challenge. It's an extra barrier that you're putting up there.
Definitely. And I think that there's a future research grant for the 3 of us to see what the uptake is amongst healthcare professionals. And it has to go through ethics. It has to be de-identified. It'd be interesting to see what the percentage is of being up to date and giving the definition across various disciplines. But one thing I wanted to do, because we could talk at length, and obviously these short episodes do not do it justice. One final thing I definitely want, I have 2 final questions for Susie. The first one is diabetic patients, high risk because of they're immunocompromised, obviously dysglycemia impairs the immune response. And we know that sick day management is a problem. Even if they do get moderate illness, there's issues with holding certain medications, adjusting insulin if they're not eating. what are some strategies diabetes educators can use? Because there's a lot of pharmacists as diabetes educators to bring up-to-date vaccines, and why is that an important part of the conversation?
Well, I'm hoping that, technically, yes, when you have diabetes, you are at higher risk of hospitalizations and death due to COVID, just because you're part of that high risk population. I would be hoping that you wouldn't have to treat them any different than somebody else who we all should be getting vaccinated. We all should be getting vaccinated for the benefits of our own health and our communities and everybody else that we're caring for and that we're surrounded by. But it is true. If somebody didn't just accept that as in the presumptive, everybody should be receiving their flu shot and their COVID shot and the pneumonia shots for people with diabetes and their shingle shots, and I suppose I could keep going on. But technically, if they don't accept that, then I do let them know that, especially when your sugars are not at target, that your health outcomes are generally poorer, or it's harder to fight an infection when you're already behind the 8 ball. And sometimes when you have an infection, not only does COVID happen, but then because your sugars are out of whack, you have less reserves that put you at risk of a cascade effect, which could lead to, anything from acute renal injury to strokes and falls and things like that just happen. Because which could have easily been prevented with vaccinations.
That's such a great explanation. And even those who are, stable, quote unquote, stable with their diabetes. And if that's self-proclaimed, obviously, Susie, when you do a deeper dive, it's usually not the case, but let's keep it that way, because even those who get a lot of these, cytokine responses from these acute respiratory infections, they often run into dysglycemia. They can't control their sugars after the event, even though they could control it before. So that's a really good explanation.
It's that same sort of explaining to them that they have less reserves than other people.
Definitely. And speaking of reserves, my last question is, you've run 5 out of the 6 major marathons. Which one is missing, and when are you going to do that?
Boston, and I can't run that fast. So it's going to be a long haul to get there.
Definitely.
But interestingly, they're coming out with a 6th world marathon, and that's most likely going to be Sydney, Australia. There's, I think, Chengdu and somewhere South Africa, Cape Town, I think it is the other one in contention. But we're thinking it's going to be Sydney, Australia will become the 6th or 7th. So then we'll have to go for 7 out of 7.
I was just in Cape Town. If you could get to Cape Town, they were great hosts for the World Pharmacy Congress there, and what a beautiful city. Yeah, it was great. And we had a pretty good Canadian delegation down there, so it was they were awesome hosts. I was really impressed with the conference. I know we're running long on time, but I wanted to ask you both one last question, because it's something that's coming up repeatedly. What's going on with the timing of these vaccines? Because we know cases of every year. It seems like cases start to spike August for sure by September, but we're playing catch up with the vaccine. Do we see this changing? Like, what's going on behind the scenes? Because I get asked and I actually don't know what the right answer is here.
Well, you are correct. Nobody knows the right answer. I think one of the biggest challenges is, we know influenza, since, obviously it came on the scene in 1918, we've got an established seasonal pattern with that respiratory virus. COVID is new, and unfortunately it's here to stay, and it hasn't quite settled into that same pattern. And despite the fact we would love logistically, from an implementation, from an immunization program perspective, to have co-administration is safe, effective, gets patients protected conveniently in a single visit, COVID flu. It just hasn't quite hit that same sort of seasonality. Hopefully it'll settle into a pattern, but at this point, this is our attempts at trying to get this stabilized. So probably not the answer that patients are looking for, but again, it just shows us that COVID continues to be an issue.
Yeah, that's the only. Yeah, I think that once it becomes a 2-in-1 vaccine, it'll be easier for us, and the whole conversation will be easier. But until then,
Yeah.
we're still it's still evolving, and I guess it's just a matter of us pharmacists doing the best we can, which is what we've always been doing, right? Just keep doing our part in our communities to make sure that the people that come to us for care, that are seeking our help for care, that we are actually providing care to them.
I think that's a great way to end, Susie, on that point. And I think on behalf of both Ajit and I would really like to thank you for taking the time out, coming on the podcast. There's never enough time. I mean, hopefully we can get you back for another segment. I mean, so I touched on this, but the pharmacy experts here in Canada really are top notch, and they do such a great job of advocating, on behalf of the entire profession. So we really appreciate you taking the time out. Ajit, maybe I'll give you the last word, and then I think we'll sign off.
Yeah, so totally. So I think as this episode comes out, we have a national, even international audience. So I agree with you, John. Canada leads the way in terms of the role their pharmacists play in administering these vaccines against seasonal respiratory viruses. And I'm confident that our pharmacists will do an incredible job this fall in protecting their patients. So with that, Pharmacists Are In are signing off. Thank you so much, Susie, for being a guest on our podcast.